I like that idea, Gladys.
Is it looking pretty?
What are you going to do with it?
Horizon Adult Healthcare, Horizon Home Care is a company that focuses and concentrates on the frail and elderly in rural Kentucky.
What color are you going to paint your unicorn?
I'm about painting green. Yeah.
Yep. This service is not a service that they could normally get anywhere else because it allows them to come here during the day to receive like nursing care. We give them 3 meals a day. We do grocery shopping for them. Pharmacy, we go pick up their meds, and they know that they could depend on us for their needs.
And I live by myself, and I don't have nobody around, and this is a wonderful place to be.
What this means for the community is that we will be able to keep people from going into nursing homes.
As we've grown and evolved, we've moved into a new space that we're renovating. It's almost a 30,000 square foot space. This is actually the 3rd remodel retrofit that we've done. We have expanded in the service delivery side into home health care.
We work all of our life, we build a home, we have our home, and of course, until the good Lord takes us out, we want to stay in our home. We provide the care, the help that client needs to prevent them from going into a nursing home setting. And I think it's a great need in this community.
In 1997, there was only 6 adult day facilities in the entire state in highly dense populated areas. Nobody wanted to serve the frail elderly in a rural setting. The concept and the idea was unproven, untested. I had nothing other than this is what I would like to do, and Kentucky Highlands helped us.
Kelly, he was a young man with an idea, made our first investment in him. We've been investing in him ever since.
Their board has adopted investing and lending to small businesses that are sustainable. The CED is really a flexible program. We've been fortunate to be able to secure grants that we can lend to businesses, oftentimes for working capital, and at very favorable terms.
Without, Kentucky Highlands and OCS funds, it just wouldn't be possible. You wouldn't be able to get a traditional lender or a bank to work with us and take that kind of risk. Both the patients that we serve and the folks that work for the company, the majority of them come from a low-income, impoverished area. As a matter of fact, our very first center was in an empowerment zone. So these are the poorest of the poor.
We cover some of the most distressed counties in the Appalachian region. The southeastern part of our service area is really heavily impacted by coal mining.
This area at one time was booming with the coal business. When the coal business went out, this area depreciated.
All of a sudden, nobody has a job, there's no income coming in, nobody's buying wash machines or cars, nobody's going to the restaurant to eat. So it just has a trickle impact.
We estimate about $13 billion in direct payroll has been lost out of our service area from 2009 to 2021.
The desperation that someone has with losing their job is traumatic anyway, but they don't know how to do anything else. They have this hopelessness that is just haunting. Most of our folks that we employed would be on public assistance. There's no question about it. They either are in a low-paying wage job or they weren't working at all. As you see jobs coming back in different industries other than coal, a lot of those folks are working for us. You see that hope come back where there was helplessness before.
With me not working at Horizon, I don't think I would be as happy as I am because it's just a joy to me just to come in and just see the clients and just know that they're happy. And I love being able to make a difference in someone's life. I felt like I was just meant to be here.
I'm getting paid for what I love to do. And, that's what makes us special.
The jobs that we've created, they're good paying jobs with benefits, 401k and dental and vision. We have a lot of people who've never had health insurance in their job before, ever. And there's just a pride in somebody who has a job that has that kind of benefit.
There's a public perception that Federal dollars invested are a one-time waste of money, but I would beg to differ with this program because it builds equity in the entities that obtain the money. That business pays taxes. Those employees pay taxes. They pay in Social Security, which really provides for their family well into the future.
Entrepreneurs in energy communities that have been seriously impacted by the loss of coal jobs, my advice would be try something new. There's plenty of opportunities here. The people are still smart, they're still motivated, they're still dedicated.
Are you going to name it?
And I'm going to name it Spot.
I hope that the next person who sits in the chair that I'm sitting in now can see how awesome these rural communities are and how awesome these people are and how dedicated they are. It is a humbling thing to see something that is really gone past something that you ever thought it would be. All I really wanted to do was take care of old people in my hometown. That was my only thought as a 28-year-old person. I want to help these people. And it's gone way past what I would ever dreamed that it would have been.